Hello everyone, I am Dr. Shankar Dey. Today I am going to tell you most important topics for NEET 2022. The topics which you must know before entering the examination hall for NEET 2022. So starting with the subject anatomy. For anatomy you must know all the cadaveric images. In the examination you will be given one cadaveric image. In that image one structure will be marked and you have to identify that structure, and you have to know all the detailed anatomy and applied aspect along with the structure identification. So the first important topic for nowadays examinations, like either it is INICET or NEET, for every competitive exam cadaveric images are very important. So cadaveric images, their identification, their related anatomy and applied anatomy also. So first thing, this is the most important things. You can expect at least 1 to 2 cadaveric images for every competitive exam. Next, nerves of the upper limb. So nerves of the upper limb, their injury, taste and muscle supply, like nerves like median nerve, ulnar nerve, radial nerve, common peroneal nerve, femoral nerve. So nerve, their origin, their muscle supplied by them, sensory supply, their injury at various level, and test performed to detect their function is very important. Like car test is done to check the integrity of palmar interosseous muscle for deep branch of ulnar nerve. Similarly, another test like some other tests like book test or pen test. So these are very uh, important questions for upcoming exam. So I think in the last exam pen test image was given. So not only their theory part, you should also know the image which can be given in the exam. So cadaveric images, nerves of upper limb, lower limb, etc. Then brachial plexus is another very important topic. Brachial plexus. Next is anatomical snub box. So you should know the boundary of anatomical snub box, its contents, then its roof. You should know all the details about anatomical snub box along with extensor compartment of ridge joint, six compartment, 1 2 3 4 5 and 6, and a detailed anatomy of anatomical snub box. Next very important topic is muscles of hand, their origin, insertion, action and nerve supply, especially palmar interossei, dorsal interossei, lumbricals and which muscle? So palmar interossei, dorsal interossei, lumbricals. So these muscles are the very important for competitive exam. Next, muscles of mastications like lateral pterygoid, medial pterygoid muscle, temporalis muscle, and masseter muscle. These muscles are important from image perspective also. One image can be shown and their origin, insertion, action may be asked. Next, structures passing through skull. This is very important questions for nowadays. Yes, so one image will be shown and one foramen will be marked. You have to tell which structure passes through this foramen. So this is very important for image based question. So cadaveric image can be given. Another applied aspect image also can be given, like suppose Terrian region is masked and the applied anatomy was like about some extradural hematoma, and the question may be like the source of bleeding in extradural hemorrhage is which artery lies beneath this Terrian region. The answer is medial meningeal artery, MMA. So this is the source of bleeding in EDH or extradural hemorrhage. So the question can be formed with clinical aspect. So you should know the detailed anatomy, their images and also applied aspects. Next, another thing that is important is type of joints are their example, like what type of joint, incudostapedial joint is what type of joint, sternoclavicular joint, first metacarpophalangeal joint, wrist joint, knee joint, shoulder joint, hip joint, then atlanto-occipital joint, any joint can be asked. So these types of joint, their example is very important. In the INICT exam, column A, column B can also be given. Match the column with column B. On the column A, there can be joints name. In the column B, there can be types of joint. Next, another thing that is very important is openings in the diaphragm and their contents. So major openings at the level of T8, T10, T12, or vena cava opening, esophageal opening, or aortic opening, along with the other contents are most important. Along with the aorta, which are the other structure that passes through the aortic opening. So these are the major opening. Their contents. Developmental of diaphragm is also important. Next, images from embryology. So I think in the last INICT examination there was the image of double bleb sign or double bubble sign, sorry, double bleb sign or the double sac sign. So any image can be given from embryology part like notochord or nucleus pulposus related anatomy related questions, or heart bulge or developing heart images, or any fossa ovalis, patent foramen ovale, any membranous septum, anything can be given along with their embryological basis you should know. Next, coming to question, epiploic foramen relations, and for liver epiploic foramen boundary is very important along with one clinical or applied aspect, that is Prinzel maneuver. Next, histology is one of the important segment for nowadays. So I think in the last NEET examination there was one histology regarding tongue papilla. I think circumvallate papilla image was given. Similarly, you can expect any type of histology image. Either it is urinary bladder like transitional epithelium, or trachea pseudostratified ciliated columnar, or anything like esophagus stratified squamous, or any cartilage, either hyaline cartilage, elastic cartilage, or fibrocartilage, or cerebellum. Cerebellum is also important from histology perspective, like Purkinje cells, any nuclei or other cells, and thymus gland also with Hassel's corpuscle. So histology you should know well, because you can expect one histology question. So you can expect one histology question, one nerve related question, one base of the skull or foramen related question, one muscle related question, one artery related, one foramen or triangle related question, and one embryology related question. So for embryology, another thing, that is pharyngeal arch and pouch is very important, like derivatives of first pharyngeal arch and their clinical importance, like Dijot syndrome. So you should know in the last INICET, I think INICET July examination, one applied question was there regarding Dijot syndrome, absence thymus gland hypoglycemia. The question was, which embryological structure is affected? The answer is third pharyngeal pouch. So the question can be formed uh, from clinical aspect. So you should know the pharyngeal arch pouch cleft derivative. This question is very important. Pharyngeal arch. Next, bones. So nowadays one trend is there regarding bone image. So one bone image can be given and they can ask the muscle attached there, types of joint, or which type of epiphysis or appearance of epiphysis or diaphysis can. So muscle attached nerve related, like last time one question was there regarding, one very long clinical question was there regarding damage to ulnar nerve, and the question was not direct. The question asked was, one image of the humerus was given and four region was marked like A, like B, like C and D, and the question asks the nerve damage is related to which part of the humerus. The answer is this. The answer is D, because the ulnar nerve passes just behind the medial epicondyle. So the question can be formed like in this way. So bone, their muscle, nerves relation, etc. So you should know the anatomy aspect very well. Your anatomy knowledge should be clear to rightly do these questions. Another thing that is important is circle of Willis. So this is blood supply of brain is important. Next, blood supply of the nasal septum and little area. So little's area, like which arteries that which arteries helps in formation of little's area, and which is the principal artery for epistaxis, and order of ligation of arteries during epistaxis. These questions are important. Similarly, ligaments of spleen is important. Like last time in the INICT exam, one question was there: which ligament prevents downward displacement of spleen? Spleen. I think phrenicocholic ligament is the answer. So ligaments of spleen, along with arteries, vertical branches of the aorta, like celiac trunk, superior mesenteric artery, inferior mesenteric artery, their branches is very important. Their identification in CT angiography and MR angiography. Recently one trend is there, they can given CT angio or MR angio, and you have to identify these branches, arterial branches. So you should know the celiac artery, superior and inferior mesenteric artery branches very well. Next, coming to another important question, that is signs like Trendelenburg sign, Popeye sign or Trendelenburg test. These things are very important. Next, coronary circulation. So coronary circulation is very important, like arterial supply, right coronary artery, left coronary artery, their branches along with their clinical implications, like which is the most common artery that is affected in uh, atherosclerosis. Okay, and venous drainage, like coronary sinus is also important, and their tributaries. So image based question can also be given, like which one is great cerebral vein, middle cerebral vein, small cerebral vein, like this. And next thing that is important, recent trend, cross section or sagittal section of brain, along with structure identification and related anatomy, like identification of the cerebellum, identification of the fornix, identification of the septum pellucidum, then Broca's area, Wernicke's area. These things are important for anatomical image, cadaveric image point of view. Next thing, triangles are important, like Callot's triangle or hepatocystic triangle, their boundary and contents. Then image based question about dermatomal distribution, like suppose angle of mandible, this region is angle of mandible, this region is this region sensory supply, like great auricular nerve or fast wave space. So fast wave space of the feet, this region is supplied by which nerve, like deep peroneal nerve. So these questions, so dermatomal supply related question are important, along with superficial or sensory supply is also important. Like from clinical aspect of view, last time one question was there: which nerve is damaged during great saphenous vein graft intake? So as great saphenous vein, along with great saphenous vein, the nerve that courses along with great saphenous vein is nothing but saphenous nerve. So saphenous nerve goes in relation to great saphenous vein. So there is chances of injury to the saphenous nerve during uh, during great saphenous vein graft intake. Okay, so these anatomical aspects, applied part is very important. Next, lobe is important, lobes and segments of liver. Then liver image based question for posterior and inferior surface of liver, along with porta hepatis, bare area of liver, ligaments of liver, like ligamentum teres hepatis, ligamentum venosum, their embryological basis of origin. These things are important. And various impression, like cardiac stomach impression, renal impression, colonic impression, jejunal impression. So these things are important. Gallbladder impression. Next, coverings of the kidney is very important, from outer to inner aspect. Which are the coverings, like renal capsule, perinephric, then perinephric fat, paranephric fat, fascia of Zerota. These things are important. From inner to outer or outer to inner, for an image based question, anterior and posterior relations of the kidney are also important. Next, inguinal canal is a very important topic, like boundaries of the inguinal canal, contents of the inguinal canal, female and male, what are the differences, then inguinal canal related applied aspect, like direct inguinal hernia, indirect angular hernia, Hasselbalch triangle. So these things, spermatic count and their contents, these things are important. Then rectus sheath is also important topic. Rectus sheath, their contents and their formation, how formation of rectus sheath differs at various level. What is linea semilunaris? So these things are important. Next, nerve is very important. As I told you before, nerve disease and injury like foot drop, wrist drop, finger drop, carpal tunnel syndrome, neuralgia paresthetica, pronator teres syndrome. So various syndromes related to nerves are very important. Along with also tendon related syndromes are also important, like golfer's elbow, like tennis elbow, like decorvent tenosynovitis. So these things are also important. Next, areas of brain is very important. As I told you before, image based question like Broca's area, Wernicke's area, their Brodmann's number is important. Next, Sipshan fascia, suprapleural membrane, their formation attachment is important topic. Along with hilum of the lung is also important topic. Hilum of lung and hilum of lung bronchopulmonary segment, and also relation of lung surface, especially medial surface. So medial surface of lung relation, this is actually image based question. Medial surface of lung, like impression of arch of aorta, descending thoracic aorta, what is the relation of vagus nerve, what is the relation of the phrenic nerve. So these things are important. Then epithelium is one of the important topic for nowadays examination, like what is the epithelial lining for tongue, heart, palate, esophagus, urethra. Transitional epithelium is seen from which to extend from upper level to lower level. Urethra, membranous prostatic urethra, there epithelial lining, tracheal epithelial lining, gallbladder. So these things are important. Epithelium, histology is very important. Then larynx is also important topic, like muscles of larynx, like safety muscles of larynx, abductor, adductor, tensor of the vocal cord, relaxer, then relaxation of the vocal cord, then inlet of larynx, then vestibule of larynx, saccule of larynx. So these things are important. Also nerve supply of larynx, both and sensory supply is important. Also the motor supply is also very important. Also, not only safety muscles of larynx, safety muscle of trunk is also important, and especially trunk development is very important along with nerve supply. So what is the nerve supply of the anterior two-third of the tongue? Taste sensation and general sensation. Also posterior one-third and posterior most, and what is the embryological basis of origin. And these things are important. So tongue is also important topic. Next question, tonsil is also important. Tonsillar artery related to ENT question is important. What is the source of reactionary hemorrhage after tonsillectomy? Tonsillar bed. So ENT, from ENT point of view, these things are important. Next, heart tube derivatives is also very important topic. Interatrial septum, intraventricular septum, fossa ovalis, limbus fossa ovalis, arch arteries, IVC development. So these things are important. Okay. Next, white matter tract is also important topic. Mainly the type of fibers, white matter fibers, like what are the association fibers in brain, what are the commissural fiber, what are the projection fibers, like projection fiber like internal capsule or corticospinal tract. So types of fiber like fornix is association fiber, also commissural fiber. So type of fibers you should know. Then deep cervical fascia, deep cervical fascia you should know, like investing layer, petechial layer, p-vertebral layer. You should also know the carotid sheath, axillary sheath topic, along with danger space of the neck, then retropharyngeal space, parapharyngeal space, etc. Then triangle of neck and their contents, boundary, roof you should know. Sometimes this may be asked also. And surface marking, recent trend, surface marking for anatomical structure. I think one question was there in the last INICT examination. The question asked which structure is palpable just beneath the clavicle. So which part of clavicle is palpable? Scapula is palpable just beneath the clavicle. Answer is coracoid process. So the question can be asked related to the surface anatomy, like once the INICT in the INICT exam, they asked about the right border of the heart surface marking. They marked one line on the chest and they asked about the what this line denotes. Actually that was denoting right border of heart. Similarly you can in upcoming exam they may also ask a plural level of pleura or level of lung at mid axillary line, mid clavicular line, in which space, so they can ask. Then deltoid ligament is very important, deltoid ligament. Then arches of foot, both medial and lateral longitudinal arch is important, along with extensor and flexor retinaculum. Then inversion, eversion, and which muscle helps in inversion, eversion. Lumbar plexus is also important, as I told you before. Brachial plexus is also important, and for lower limb, lumbar plexus. Heart interior images is very important, like they can mark any structure like membranous septum or any muscle or anything. They can mark limbus fossa ovalis, muscularis pectini, or anything, papillary muscle or papillary muscle. So they can or any IV septum. So they can mark any valve. So you have to identify the heart interior structure. So cadaveric image, follow the cadaveric images of heart. Extraocular muscle is important, like function of superior oblique muscle, lateral rectus. They, not only their function, both function and nerve supply is very important for extraocular muscles. Similarly, similarly, supraorbital fissure is also important. What are the structure that passes above the annulus of gene? What are the structure that passes uh, inside the annulus of gene and below? So contents of supraorbital fissure is also important. Along with nuclei of cerebellum is important topic. Azygous and hemiazygous vein, their formation is important topic. Types of collagen, like type 1 collagen, type 2 collagen, type 3 collagen, type 4 collagen. In which structures this type of collagen is found, which collagen is found in basement membrane, decimate membrane, or during healing, which collagen is predominant, which collagen is predominant in hyaline cartilage, in reticular fiber. So these things are important. So lastly, summary, these things are very important as I told you before. So nerves are very important, their identification, supplied structure, and along with their taste, artery branches is important. So these are actually important from image perspective. So image point of view, vein, their tributaries is important. Any muscle, origin, insertion, action, nerve supply is important. And for spaces and triangle, like quadrangular space, upper triangular, lower triangular space, like femoral ring, femoral triangle, popliteal triangle, cubital triangle. So these triangles, their boundary contents. So these things are important. So I think I have told you the most important topics for NEET. If you are ready with these 50 topics, I think you can cover 70 to 80%. 100% sure, for 70 to 80% question you can attend. So um, so study thoroughly these 50 topics, and don't forget to subscribe my channel Dr. Shankar Dey. In the next session I am going to discuss important topics for physiology. So I will discuss one by one important topics for NEET-PG and INICT examination for all the 19 subjects. So stay tuned for the important topics for INICT and next and NEET examination. So thank you for watching.